It's very brown, the little tooth that he's got there.
Yeah.
Has he got a tooth at the bottom?
No,
Really?
just the top one.
Hi everyone, I'm Lynn from Cavy Central Guinea Pig Rescue. So we have Pin.
This is Pin.
Now Pin is a microthalamic.
I've never heard it called that before.
Yeah, or a lethal.
Lethal, yeah.
Well, there's two things.
Yeah.
A lethal is what he is.
Yeah.
So he's been born with issues revolving around the roan gene,
Yes.
most likely being involved.
Definitely.
So when we have what's known as a pink-eyed white or a lethal guinea pig, it has severe issues, often revolving around malformations and pops. So in this case it's called Pin because he has one tooth.
He had a brother with the same condition, but he
passed away
about 3 weeks old.
Yeah, so
Yeah.
they often have issues with teeth, with malocclusion, with eating, with even deformities. They're often born dead.
Suckle well,
Yes.
so
Oh, he wouldn't with his tooth.
syringe fed
Yeah.
for the first few weeks.
Yeah. So they also have what we call microphthalmia, and that is the eyesight issue.
Yeah.
So
He's
when
been
we
blind from
and
birth.
he's got
He's been deaf from birth as
well. It's more so microphthalmia is reduced eye size, even down to no eye.
I've seen.
Yeah. So he's got
some-
microphthalmia.
I
So
follow some pages on Facebook. That,
yeah, that's the difference in that.
people.
You know, someone's not holding you. His mum. Okay, that's all right. So he's fully blind. This boy.
He was pretty sure. The vet when he was 2 days old
He is.
couldn't detect any
Yeah, no, he's definitely fully blind.
And
I can
same
tell
with
because
the-
he's using full-on scent.
deafness. Didn't seem to be
So
able to
he's
detect any sound.
eating less at the moment.
Yeah, he's just not getting through
The
the same amount of
volume.
veggies or grass that
Okay.
he usually it all disappears, but he's
Yeah.
leaving some behind just this past week.
Okay. Have you weighed him? Like, do you keep a weight measurement on him?
I don't know if it's updated though.
Just in terms of if he's lost any weight.
He's always been about. Hold on, let's see, what was his last weight? Let's check. Yeah, so he's lost a little bit.
What's a little bit?
About what is that? About 40 grams
Okay.
from what he usually is.
That's not. I see the cyst. Yeah.
Yeah,
That's just a little sebaceous cyst. And
yeah.
they're very easily treated. It's quite low at the moment, so just leave it till it comes a bit closer to the surface.
Yeah, well, it hasn't
And then
changed
we
at all, and he's had that for a few months now, so.
Yeah, it'll at some point it'll get closer and we can just treat it then. It's easy. Okay. So is there a particular food that he is eating or not eating?
He's eating all these
his
dries.
He's mixed his dry
and his
food.
hay.
Yep.
It's just the veggies and the grass that he's eating it, but just not as much.
Okay. All right. Hence the name.
Yeah.
It's very brown, the little tooth that he's got there.
Yeah.
Has he got a tooth at the bottom? Or
No,
not really?
just the top one. So it grows out,
Okay.
and every time I book him in to get it trimmed, he
It falls
breaks
out.
it himself.
Okay, I think it's close to that happening now, because it's very browned off at the very browned off. Yeah, I don't want you to get me.
And he had surgery when he was really little.
Okay.
They tried to scoop the root out,
Okay.
but it didn't
No.
didn't work.
No.
It grew back.
He's the sweetest little boy. Yeah. Be careful you don't land on me with that little tooth. He's very accurate. You can tell. It's all right, sweetie pie.
Wiggly.
Wash. Let's wrap him up again there. Look, honestly, keeping an eye on his eating and the weight.
Yeah.
He's dropped 40, but
Yeah.
it has gotten cooler. So
Yeah.
the weather temp has changed. I'm just going to listen to his chest. Wiggler. Little wiggler. again. Don't want him to be too tight. Okay. I can't hear anything on his chest at all, so that's positive. Actually. It's his tummy more than anything. I can hear all the mulchy noises going on in there.
Okay.
Let's have a roll out. It's not really got any discharge happening at all that's obvious. So with the noise on his right lower side, you can hear his tummy really splonching around in there.
Grumbling a bit.
Not grumbling, it sounds more like fermenting. So I wouldn't actually worry about that so much. I think that his tooth is probably very close to breaking off again and will probably break off soon.
Yeah.
His eyes, his nose are clear. He's got the little sebaceous cyst you don't need to worry about down there. No.
He likes to chomp on your fingers.
Yeah, I can see.
Nom nom nom.
So no, you're not going to chomp on me. But yeah, he's super cute.
Yeah.
Super cute. So I think keep an eye on his weight. There's nothing that's indicative of a problem right now. His lymph system is fine.
Beautiful.
So I would be looking towards what's changing in the here and now, and I think of temperature, with it getting cooler at night,
yeah.
maybe giving him something extra to snuggle into, or just something different to what he already has, that might help him a little bit more. With animals that are compromised, you know, in the way that he's a younger animal, but he's carrying problems that age him and make him more vulnerable, giving him that bit of extra care like we would an older age piggy might help him. Yeah. That makes sense. You could give him extra vitamin C right now.
Okay.
So sprinkle that on his food. You can get that from a health food place and get ascorbic acid in a powdered form. Yeah, and just literally sprinkle it on his fresh food and he'll eat it fresh. So that's definitely the way to go, particularly with the tooth issue. So I'd really bump his vitamin C.
Okay.
But I don't think there's anything specific he needs treating for or doing at the moment. Yeah, he's super cute.
That's what we like to hear.
Hey, Prin.
Yeah, like when he was tiny, a couple of vets said that he should just be put down.
A lot would, but yeah, he's beautiful.
He's now
He's
nearly
a special
3.5.
boy. Wow, you're a special boy, Pin.
Yeah.
Yay. Yeah, he's really special. He's very lucky. Okay, who do we have next? I'm going to check and put you down.